Hello, everyone. Today, we're going to talk about the impact of health disparities on children. So I'm going to go through a few slides with you very briefly, and then during the time that you're watching these, you're going to want to pause and watch. There's several videos that go along with this. So I'm going to click out of myself here and pull these up for you. So this is going to go along with this week's assignment, which is called Roots and Branches. And so what you want to do is watch the presentation and videos, then answer the following question for each of the 5 problems discussed. So we're going to go over poverty, oral disease, childhood obesity, and then children affected by addiction and the opioid epidemic, as well as children of the incarcerated. So for each of these 5, you want to determine what are the root causes that actually lead to these health problems. So you're really going to need to watch the video and also think about different things that we've talked about throughout the semester, thinking back to those social determinants of health as well. The second part of the question is to think of 3 possible strategies or solutions or the branches that would help in reducing these health disparities and solving these problems for children. So I encourage you to, again, kind of work through this, take notes as you're going along with the videos as well. So first off, poverty is a huge issue in terms of access to food and to resources, to good education, depending on where children live. So we really covered this early on in the semester when we talked about socioeconomic status, but children really are ones that are very deeply affected and then are affected for the rest of their lives based on what opportunities they had as a child. So this is a map that just shows the percent that are in actual deep poverty. So Virginia is about 8 to 10%, and wanted to show you the Lynchburg map here if it will pull up just briefly, and I'd encourage you to explore this as well. So this is in Virginia, which we have, it's 22-23% up to 24 in the last few years, but almost 1 in 4 residents, adults, population, families are in poverty in the Lynchburg area, and that there's been numbers up to 60% for children. And there are even some schools with 90% of the children receiving free and reduced lunches. So during this time right now with COVID-19 and not getting access to the normal breakfast and lunch and food that they get at school, I'm sure you've seen on the news, or maybe your families or people you know are experiencing it, but they are continuing to distribute food, which is awesome for these children. But you can go on and click. So the darker the color, the higher the rate of poverty. So you can see how that dark purple gets into that 60%. And it's nice because you can also see then the population of that area by race over here on the left, and scroll down. So in this area of Lynchburg, you can see the median income is 24,000. And you've got almost 3 out of 4 people in this location are Black or African American. So in this area, we have actually a large population of white, but they're also very impoverished in this area. So I encourage you to kind of explore that as well when you're looking at poverty, and think back to what we discussed earlier in the semester in terms of socioeconomic status. But how can we really help these children, have the opportunities that that others have for good health and for good education and things like that. So the next one is oral decay and caries, or oral disease. So you are going to want to stop here and watch this short video. I'm not going to pull it up here just to get through these slides and you stop them. But oral health and disease is a really big issue for particularly impoverished children, and children that experience decay and caries, it's a lifelong issue. Once your dental health starts going down, and if you're not treating it and preventing worse cases, then it's just going to continue to get worse and worse over time. Kids will miss school, or if they're in a lot of pain, they will not be able to participate or concentrate. For example, eat. If you think of if you've ever had a really severe tooth pain, You know, did you eat? How did it affect you? And think of that as a child in school and that pain not going away. So in this chart, you can see those by age that experience dental caries. So dental caries are cavities. So here, 2 to 5 year olds, 22%, about 1 in 5, a little bit over. But you get up to 6 and 8, half. So you see how if they're not treated, it's going to increase. Okay. And then non-Hispanic, Black and Hispanic populations here have much higher rates, followed by non-Hispanic Asians and then whites. So those are people that experience them and then that actually then go untreated here below. And again, it gets worse over time. So we want to get children helped at a very young age with oral health promotion programs and to get rid of the cavities at an early age and teach good practices, right? So the next one, remember to have stopped and checked out that video. The next topic is childhood obesity trends. So, you know, our country, of course, we know obesity is an issue, but the trends in terms of childhood obesity has gone up, but we've been lucky in Virginia to have seen a decrease. So in this chart here on the right is from Virginia 2016, we were ranked 12th, but we were actually up there, we were number 1. When I gave this presentation last year, the earlier map, we were yellow here, which is 20 to 24.9% for our children ages 2 to 4 with obesity. These are the WIC participants. But we are still in the green, so we are higher. The green in terms of the country, we've seen some of the states put a lot of funding and grants into obesity prevention programs for youth, which are showing to have helped. Like I said, Virginia was yellow the last year when I presented this, and we are now in the green, which is awesome. And this here link is interesting to look at and see different trends. See if this pulls up. Here we go. So this is a national obesity monitor that you can check out. So youth obesity rates 2 to 19 from 2015 to 2016. This is the latest that they have, 18.5%. And all youth versus adults. So look at what's going on as, and it's known that children that are obese are more likely to be obese as adults. So it is something that we want to teach our youth and children because a lot of times it's not their fault. And there's reasons for why they are obese, and it is often out of their control. And that's what I'm encouraging you to look at in the look through this, and again think of different things we've talked about. What are those root issues of why children are obese? Okay, and it's going to link to again different social determinants and topics that we've talked about over the semester. But here, if we look from 1971 to 2016, the trend has gone up. We saw a dip here. That was nice. It'd be interesting to kind of see what happened here to cause that big dip. You know, can we do that again? Because now we are creeping back up. And same with adults going up. So the grants have worked in Virginia particularly, but how can we really lower these numbers? And you can actually go in and look at states. Oops. Let's see if we're Virginia. Let's see what Virginia's got here. New data. So current obesity rate for 2 to 5 year olds is 15%. But you can see how, look at in 2010, 21.5%. So very high up there, 20%. 1 in 5 youth were obese in those years. So getting down there, but how can we even get further down? So encourage you to explore that website as you explore this problem here. See here, sorry, getting out of here. Okay, next topic, children affected by the addiction and opioid epidemic. So if you remember, particularly, I mean, this this crisis affects all races, all socioeconomic status levels, but children are really, really affected by this. And so you will hear, there's a video to stop and watch to get an idea of how they're being affected and how it's affecting the overall system. But in particular, when talking about this and how children are affected, they're losing their parents. And so up here, 28% of children taken into custody in 2015 had parents using opioids. So almost 1 in 3, 33%. And they're remaining in care much longer. So they may be in foster care. So foster care increased by 20% in this year. And we've got more children in care today, 1,336 that are more children in care today than 6 years ago. So huge increase on that. And you know, when they're not with their parents or they're in foster care, and there's good foster care situations and there's bad foster care situations, and it's very difficult. And then as you'll watch in the video, many are ending up with grandparents and other family members, and there are issues that go along with that. And I don't want to give it away because I want you to watch the video, but it is a huge problem. And then when children aren't with their parents and their moms and dads, you know, that's going to affect them in the long run as well. So how is this, you know, yes, the children are, you know, ending up in foster care, but those that aren't, you know, they're, you know, having parents that die, but then there's a lot that are just in that environment of parents using and abusing these drugs. And so the opioid epidemic is highlighted here, but I added addiction just so that, you know, in terms of other drugs, alcohol, alcoholism, and methamphetamines. So there's other drugs too that can cause, that don't have such the high death rate, but, you know, increased risk for abuse and neglect and those types of things. So take a look at these statistics too. But in 2016, 2.1 million people had an opioid use disorder. So how many of those, you know, had children and are affecting those as well? And if parents are spending money on drugs, they may not be getting the food or being able to participate in things, getting books, getting the things that they need to improve their health and well-being and succeed in life. So in 2017, the number of children affected by the opioid epidemic by age, so really young ones too, guys, almost 1,904,000 ages from 0 to 5 affected. And that's really sad and unfortunate. 662,000, 6 to 11, and 600,000, well, 610,000, 12 to 17. So, and there's just a lot of societal costs that are linked with that. So use these slides and watch that video from the slide above. This article here, this link is to an article that is very informative that may give you some good ideas too for solutions and those branches, part of your activity or assignment. And the last one here is children of the incarcerated. And I'm not going to say a lot about this. We talked about the school to prison pipeline earlier this semester, but this is a little bit different in terms of how are the effects of children when their parents are incarcerated. So this is a little bit longer video, and it does a really good job of explaining different issues and also solutions and strategies. So you will want to take a look at that for your final topic for this assignment. So again, just a reminder, after watching this presentation and the videos that I've mentioned, and then also using the links, and you can use your textbook as well as any other resources you want to online to help with this, but come up with the root issues that lead to these each problem. You know, 2 or 3 would be good. You know, there aren't going to be 20 root issues. You know, there may be one major one, but describe it, okay? Don't just list it. Give a very brief description. A couple sentences is great. And then what are the possible strategies and solution or those branches? So do that for those 5, and I will look forward to reviewing those when you're completed. And if you have any questions, please let me know.